We have the great pleasure to have our partners from Berlin here, the company Medigo, Mr. Karan. Karan is an exceptional case manager, and we work together personally, me, myself, and our other case managers from KCM Hospital work with Karan and his team since 2013. So we have quite some intelligence in what we do, and we believe we are doing this quite well. So Karan, first of all, welcome to KCM. This is your first visit, official visit to our hospital.
Thank you very much for the invitation, Philip.
Yes, pleasure. And tell us, so how does it usually work? A patient contacts you first. Let's say I'm looking for a spine surgery, correct? Yeah. I will contact Medigo in general, and what happens? Like, what is the patient's journey?
So basically, the journey within Medigo, let's say, they send their inquiry over to us at our platform, at our portal, let's say, and they submit their inquiry online towards us. So we get a notification that this person, let's call this patient, for example, James. We'll name him James, for example. James approaches us and says he needs corrective spine surgery. Because he's been feeling he's had lower back pain issues. The first point of contact with him would be either via email or via phone. Of course, we always try to contact them, call them first, see if it's the appropriate timing for him to speak, and of course try to understand his situation better. Yeah. And of course, the most important thing is, what is the need for him to contact us? Why did he approach us? And what is of course the urgency on him? Like what is he basically looking for? What sort of type of treatment? That's the important thing, and see how we can deliver in the best of our approaches.
Absolutely. And how can you support him? You will ask him for some medical documents?
Yes.
If we are looking at James, who is looking for spine.
Yes, we would of course ask him to send us either the X-rays or MRI images to try to understand and detect what the problem is. Within the team, when we receive the medical documents, we try to discuss this together, especially with the management, and we do have the chief medical officer and a few other colleagues who are very experienced, and they share their knowledge and insights with us, and they give us some advice of like what sort of treatment this patient needs. Of course, when we are in touch with them, we ask them like, look, where is the preference and destination? Where are you looking to travel to get this treatment done? So that's something very important to consider, and also their budget, because
at the end of the day, it's a topic always.
It's a topic always. I mean, patients who approach us, they understand that they're self-paying patients, of course, and we want to support them based on their budget, based on their destination, based on our professional feedback and knowledge within our network of clinics, because as you know, we have over 900 clinics within our network in, God knows, like what, more than 40 countries, I'm going to say.
Amazing. Okay.
And
so the patient has a variety to choose from?
The patient has a variety to choose. I'm guessing these numbers are, let's say, recent numbers, or numbers from what I remember from my time working at Medigo now. And of course, like, it's very important to us to qualify, when speaking with the patient, try to qualify the information, try to understand his need. That's most important, and how we can best support him. And of course, we work with you quite a lot, Philip, and we, of course, once we have all the information and the medical records, we forward all the details to you, and I'm sure you...
Yes, and I guess it's also worth mentioning that this is the moment where the hospital really jumps in and takes over a little bit, correct? In terms of, okay, now we get in touch with the professor, with the actual professor in charge for that particular spine treatment, and then we will give you feedback, and then you will connect then the hospital with the patient to directly communicate, because sometimes the patient wants a little bit more privacy, or is sensitive and wants to discuss something with the professor or with the physician, correct? So I think that's the right way to do it,
absolutely.
And that's how we can create value, and how we help patients together with Medigo.
Absolutely.
And then usually it takes what, 2 weeks for him to decide, to check his options?
Well, it depends actually. If he is in constant pain and he's looking for the treatment urgently, then we can schedule everything, within the next few days, you would say? Within the next 3-4 days we can schedule everything for him, depending on the availability of the doctor. That's something very important to consider, and for him to start planning and making the arrangements. You need to consider that there are a lot of other external factors that influence on a patient's decision, and we can only provide and give our best to give all the right information to the patient and for him to make the best decision. Now it's up to them to consider when they want to look for the treatment.